our National Health Service.
The NHS.
Britain's most prized institution.
The role model healthcare system.
The envy of the world.
The envy of the world.
Not quite.
Not even close. Contrary to popular belief, there is nothing unique about the NHS's delivery of universal coverage.
Almost every developed country offers universal access to healthcare, regardless of people's ability to pay. It's not an achievement, it's the norm.
The NHS does remain unique, though, in the sense that no one else has adopted it.
Contrary to being the envy of the world, no one has replicated the NHS outside of the shores of the UK, because its systems and its health outcomes for patients aren't very good. The NHS is an international laggard in terms of health outcomes that can be attributed to the healthcare system.
In international comparisons of health system performance, the NHS almost always ranks in the bottom third, on par with the Czech Republic and Slovenia.
In Western Europe, the UK has one of the highest rates of avoidable deaths. What does that mean practically? It means that 2,700 lives could be saved each year if the UK managed to cut the number of avoidable premature deaths to German levels. If we cut it to Belgium levels, 10,700 lives would be saved. And if we cut it to Dutch levels, we could save over 13,300 lives.
The data on serious conditions like cancer paints the NHS in an awfully bleak light as well. If the UK's cancer patients were treated in the Netherlands rather than on the NHS, over 9,500 additional lives could be saved each year. More than 13,000 lives could be saved if they were treated in Germany, and more than 14,000 lives could be saved if they were treated in Belgium. These figures only refer to the 5 most common types of cancer. The total number is probably a lot higher still. Here we go.
What about the Commonwealth Fund?
This is an outlier study, which ranks the UK top in its assessment of World Health Services.
But this study doesn't focus primarily or even secondarily on health outcomes for patients. It mainly focuses on inputs and procedures. That's a legitimate way to weight healthcare systems, but let's be really honest about what this is actually measuring.
In the health outcomes category of their study, the NHS doesn't come first like it does overall, and it doesn't come second.
It comes out 10th.
10th out of 11.
When the Commonwealth Fund measures the same things as other sources, it broadly comes to the same conclusions, which is that the NHS wildly underperforms for its patients.
This was summed up well by The Guardian's report of the study, which said the only serious black mark against the NHS was its poor record on keeping people alive. It's time we stop burying our heads in the sand on a public policy issue that affects us all.
It's time we stop demonising the social health insurance systems, which prove to be working in neighbouring countries, providing everyone with a much higher quality of care.
And it's time we stop pretending that the NHS is as good as it gets, because honestly,
without a doubt, we deserve better.